Good afternoon, everyone, and welcome to the National Hispanic Council on Aging Alzheimer's and Memory Loss webinar. My name is Christine Perez, and I am the Director of Programs at the National Hispanic Council on Aging, or NHCOA for short. And it's my pleasure to moderate today's webinar. This educational webinar focuses on exploring Alzheimer's disease, memory loss, and dementia. Participants will learn about the impact of dementia and memory loss in daily life, and also practical strategies for supporting individuals living with dementia while promoting their independence, dignity, and quality of life. This webinar will also provide information on available resources for caregivers and their families, helping participants better navigate memory related changes and also connect them with services that promote healthy aging. So, this webinar is in partnership with the Administration for Community Living, also known as ACL. So, let's begin with our panel session. Alzheimer's disease is a progressive brain condition that affects memory, thinking, and everyday activities. Latinos are at a higher risk of developing Alzheimer's and other dementias compared with non Hispanic white adults. And yet, many Latino families face barriers to early diagnosis, treatment, and support. When it comes to culture and family, it plays an important role in how Alzheimer's is understood and managed in the Latino communities. Language barriers, limited access to culturally appropriate information, and healthcare, stigma, and caregiving responsibilities can make it harder for families to seek help. So, to better understand the experiences, challenges, and also the needs of Hispanic older adults and caregivers affected by Alzheimer's, NACOA conducted a series of focus groups to gather valuable community insights. So today, I will be providing an overview about the National Hispanic Council on Aging focus groups about what older adults, caregivers, and healthcare providers tell us about Alzheimer's disease. So let's begin. So let's start by explaining why this study matters. We know Latino communities are disproportionately affected by Alzheimer's disease. Latinos are about 1.5 times more likely to develop the disease, and yet they are less likely to receive an early diagnosis. So we conducted this qualitative study because we wanted to understand why, what people know, what barriers they face, and what opportunities exist to improve brain health in the Hispanic community. Next slide. So, this project brought together three perspectives. We included older adults, family caregivers, and healthcare providers. And we also conducted these focus groups and interviews in Washington, D.C. and Texas. So rather than asking people to complete surveys, we met with the participants and did focus groups and asked them to share their experiences, beliefs, concerns, and ideas. So we found four key findings that remain consistently across all of these conversations. And the first key finding was knowledge. Next slide. So the first major finding was the limited knowledge. As we know, limited knowledge and misinformation can delay Alzheimer's recognition and care. Nearly everyone associated Alzheimer's with a memory loss, but many participants did not understand what causes the disease or how it progresses. So some participants believed that Alzheimer's is developed because someone worried too much or experienced too much stress. And when it comes to the provider's perspective, they mentioned to us that they observed that families often dismissed early symptoms as just getting older, and that delayed the evaluation and diagnosis. Next slide. So I want to share this testimony. And it shows clearly that Alzheimer's wasn't viewed as a progressive disease. It was viewed as an expected part of aging. And the issue is that when families believe that memory loss is simply what happens when you get older, they are very much less likely to seek evaluation early. And when diagnosis and intervention can make a great difference. Next slide. So another key finding that we found in the focus groups was about trust, fear, stigma, and delayed screening. So here, older adults were generally receptive to Alzheimer's evaluation when recommendations came from a trusted and knowledgeable sources. For example, a primary care physician. They mentioned to us that there were several reasons of people delaying Alzheimer's screenings. And participants mentioned the fear, the lack of knowledge, even the denial that could reduce willingness to pursue Alzheimer's screening. And they also described some practical barriers that I want to highlight in this slide. And it's because they mentioned limited health insurance, or they didn't have any, language barriers, many were monolingual, financial concerns, and simply not knowing enough about Alzheimer's to even recognize the need for evaluation. Next slide. So another key finding was about resources and access gap. So in this part, we ask about health, and we ask the healthcare provider, and they mentioned that there are not enough Alzheimer's resources that are culturally and linguistically appropriate available to the Hispanic or Latino community. So many older adults were not aware of where to go for screening, where to go for referrals, and where to go for support. And also, the participants had limited awareness about Alzheimer's services that were available in their communities. So, when we asked about the preferred ways to learn more about Alzheimer's, participants mentioned that they prefer like TV and radio, or finding information at the doctor offices, or even at community centers or senior centers that they go to. And also, the participants strongly preferred in-person classes and workshops when learning more about Alzheimer's, where they could like ask questions and learn from each other. Next slide. So here is another testimonial about a healthcare provider who clearly states that people were not opposed to screening. They often just needed someone they trust, like a physician, a nurse, even a caregiver or community health worker, just to start the conversation. Next slide. So, what healthcare providers identified? Well, they encourage Alzheimer's screening and to make it easier for older adults to access. They mentioned to provide like offering like free screenings, free workshops, and educational resources available in Spanish, English, even in Portuguese as well. They highlighted the importance of addressing misinformation, especially this idea that memory loss is just a normal part of aging, and also provide culturally and linguistically appropriate information for Hispanic older adults and their caregivers. We cannot forget about them. and improve that communication between healthcare providers, older adults, and their families. Next slide. So in this slide, it's the last key finding that I want to show to all of you. It's about the caregiver perspective. So caregivers shared the emotional, physical, and financial challenges when caring for a loved one with Alzheimer's, while also they're managing for work and family responsibilities. So what stood out was that most family caregivers wanted to continue caring for that loved one in their home. They were not asking someone else to take over that responsibility. They were asking for the knowledge, the resources, and support to provide the best care possible for that loved one that is experiencing Alzheimer's and other dementias. And we found out that the level of the stress was very high with caregivers. Nearly every caregiver rated their stress between 8 and 10. So, what this shows us? Well, it shows that caregivers are carrying a tremendous burden and need more support. So, if we want better outcomes for people living with Alzheimer's, we also need to support the caregivers who are there for them every day. Next slide. So, the good news is that these challenges can be addressed, thankfully. So, participants themselves helped identify some of the solutions. They asked for earlier conversations about brain health, about Alzheimer's and other dementias, memory loss. They ask also for culturally appropriate education in their own language they can better understand, better communication with healthcare providers, and more support for caregivers. So these solutions doesn't require new treatments. They require providing communities with trusted information and support in ways that actually can work for them. And I want to also highlight that we need more research in this area of Alzheimer's. This study provides an important foundation for understanding Alzheimer's in the Hispanic community. And there is a huge opportunity to build on these findings with updated information. So that's why the National Hispanic Council on Aging is looking to continue this work and collect new data that reflects to the experiences and the needs of Hispanic older adults and also the caregivers today. So we have been meeting with members of Congress about Alzheimer's and its impact on the Hispanic community. And there is a strong interest in having current information to help guide future efforts in this issue. So we're grateful also to the Alzheimer's Association for partnering with NHCOA on this important work. So more to come. Next slide. So before I close, I want to emphasize that brain health is community health. Improving brain health in the Latino communities is about more than medical advances. It means listening to our communities, providing culturally appropriate care, supporting caregivers, and making brain health part of everyday conversations. So, to reduce Alzheimer's disparities, we need better education, easier access to screening, stronger communication with healthcare providers, and more support for caregivers. Next slide. So, as part of our available resources, if you have questions or need more information about Alzheimer's disease, we invite you to contact our resource center, a multilingual hub that empowers and educates the Hispanic community by providing accurate information and also resources to help individuals and their families stay healthy. You can reach us at or call us at 202 658 8664, or the same number that appears in this slide, or connect us via WhatsApp, the same number. And we also developed a Cafecito con NHCOA that is a series of informative videos addressing issues that are impacting Latinos. And in these videos, we highlighted Alzheimer's disease and shared more detailed information about the disease and available resources for people living with Alzheimer's and their caregivers. So you can find it in our NHCOA social media as YouTube and Facebook. So thank you for listening. And I just want to, once I finish my presentation, well, once again, please feel if you want to write your questions in the chat box, you can write it right now and then until our question and answer session at the end of today's webinar. So to close our panel discussion, understanding Alzheimer's disease requires recognizing not only its impact on individuals and families, but also the cultural perspectives that shape how Latino families experience and navigate Alzheimer's and dementia. So let's welcome Mirna de Jesus. She's the author of Nurturing Cognitive Health. No serás una carga. Inspired by her family's journey after her father's passing from Lewy body dementia. Today, Mirna will highlight key findings from the book, No serás una carga más. Welcome, Mirna.
Thank you, Christine, for that great introduction. I also want to extend my special thanks to the National Hispanic Council on Aging for the invitation today and all of the vital work that you do every day on behalf of our community. It's interesting to see how the research that you have presented today aligns very well with a lot of the research that I've conducted over the years. Like you said, this topic is very personal for me. 4 years ago, my father passed from Lewy body dementia. And that experience changed the way I think about caregiving, about culture, and the kind of support our families actually need. I've spent many years working with health organizations, listening to patients and their families, and understanding the gaps between clinical care and the reality we face at home. Today, I want to share a few simple insights from my book and from my family's experience. And I hope that these will be helpful for both the families listening and also the professionals who support them. My focus is simple. What Hispanic families need to know through the lens of our cultura. Next slide, please. You know, when we talk about memory loss in Hispanic families, the issue isn't about love. I mean, it isn't about commitment either. We definitely know how to show up for our elders, our viejitos, no? But very often the real gap is that families don't get help early enough. While Alzheimer's disease is the most common form of dementia in our community, it is often like misunderstood or diagnosed too late. Families don't always receive guidance that is rooted in our cultura, as you mentioned, right? The love is there, el amor está ahí, the caregiving is there, we know how to take care of them, lo cuidamos bien, and we show up for them every day. But the language and the tools are often missing. In 25 years of research with our community, I've seen a consistent pattern. Culturally misaligned resources simply do not get used. It does not matter how accurate the medical information is. If it doesn't speak our language or honor our values, families quietly set it aside and carry the weight alone. That was true in my own family. We cared deeply, we showed up, we wanted to do the right thing, but early on, we simply didn't have the words to describe what we were seeing in my father. We lacked the kind of guidance that felt grounded in our family's values. And for those of you who work directly with older adults and caregivers, this is like the cultural understanding really matters most. Information can be accurate, but if it doesn't reflect our family's values, their language, and the way of making sense of the illness, it may not provide the clarity or the peace of mind, which is really important for our families and what they're searching for. Next slide, please. Okay, this is my father, Alfredo. In his case, the early signs of Lewy body dementia didn't look dramatic at first. We no nos dábamos cuenta. We weren't understanding. They looked like things many families might not pay attention to. For example, we see them as aging or stress or personality changes. For example, if someone repeats the same question over and over again, many families will say, "Oh, he's just getting older, está viejito." If someone seems more withdrawn or confused, we may think, maybe he's just tired or maybe he's stressed out. That's what I mean when I say that families often don't have the language yet. In my father's journey, we saw him losing his weight. We didn't know why. I mean, we were confused. There was actually when you think about Lewy body dementia, there are different stages. And by the time we realized what was happening, my father was in a deeper stage in his journey, because many people assume memory loss is only Alzheimer's disease. Symptoms like hallucinations, my father experienced, can be even more confusing. Even the doctors we saw initially struggled to give us clear diagnosis. They saw the neurological signs, but it took a long time to name the specific illness. Looking back, in our case, we weren't looking for clinical diagnosis or medical definitions. We were just looking at my father through the lens of our love and our faith, trying to handle everything como familia, as a family. So all of this stayed with me, and I realized how many Hispanic families are probably doing the same thing. Not because they don't care, not because, not because they don't care, but no one's yet helped them name what is happening. And that's why I wrote No Serás una carga. I wanted to create something honest, something useful and clear. Next page, please. Okay, one of the central ideas in my book is that brain health is built and strengthened through everyday habits, meaning family support, cultural understanding. Whether a family is trying to prevent Alzheimer's disease or manage a diagnosis like Lewy body dementia, these pillars provide a roadmap. And in our community, these pillars are, I want to say, very different. The first is the body. This isn't just about a diet. It's about the sazon that we put into our healthy meals and the simple ways that we can improve nutrition while keeping our traditional flavors. We can choose fish, beans, and fresh vegetables while still cooking the way we love. It's about the joy of movement, like walking with the grandkids in the yard or the park. And we also need, and this is really important, we also need to prioritize routine checkups before a crisis happens. And this is very common among Hispanic families, leaving all a Dios, dejando todo en Dios, en manos del Señor, or not wanting to go to the doctor because we believe nothing's wrong. So we must remember that taking care of the body is a way of honoring the life that we have been given. The second is mind and connection. For my father, music was everything. He loved listening to Chucho Avellanet, El Gran Combo, and while he was in bed, we'd sing and we'd dance with him. This kept his spirit alive and his mind engaged. Whether it's music, whether it's reading or prayer, these activities help protect identity and connection. Social engagement is one of the most powerful tools we have to slow the progression of Alzheimer's and related dementia. And the third is family and care. We process our lives around the kitchen table. Ahí donde está la familia. This is where the most important conversations actually happen. And brain health does require medical care, of course, but it's also deeply emotional, social, and tied to our family's convivencia, our family's experience. It's about staying involved and staying curious together. Next slide, please. So, if I had to leave our families, you guys, with only a few practical takeaways today, there are three big things that make a difference. First, have the conversation in familia. No one person should carry the diagnosis alone. Too often, one daughter, one son, or one caregiver ends up carrying all the worry. They become the strong one and hide their own pain to protect everyone else. That may come actually from love, but over time it creates exhaustion and silence. When the family shares the information, the caregiving load naturally distributes. Second, use trusted entry points. Faith, family gatherings, and the kitchen table really do matter. We're spiritual people. Like our church gatherings and our communities carry a lot of the weight. Sometimes families aren't ready to hear something in a doctor's office, but they're ready to talk about it over un cafecito en la casa. We need to bring Alzheimer's education and dementia resources to the places where our families already feel safe and supported. Third, that Christine talked about a lot was protect the caregiver. I've done so much work with caregivers, and it's just part of the love I have for them. Plus, I was one. So, in our community, caregivers often think they are a burden if they ask for help. So, they carry everything by themselves. But you can't take care of others if you don't take care of yourself. So, real familismo means the family must care for the caregiver too. At the heart of this book, I want to make one central promise: que no serás una carga. You will not be a burden. In talking to a lot of the patients, I found many parents felt they were a burden to their children. They brought this up a lot. Caregivers often think they're a burden to their family. This promise that I make is made with love, but part of caring well is making sure that neither the loved one nor the caregiver carries the weight alone. Next slide, please. So here's my book. This is the reason I wrote Nurturing Cognitive Health, No Serás una Carga, and its Spanish edition, which is Cultivando Salud Cognitiva. I wanted to create a guide. It's more of a guide written for families, not something that's translated and I don't want to say techie, but medically technology and all that stuff. It's something respectful, practical, and culturally grounded. Both editions are resources not only for families, but they're for caregivers and organizations serving Hispanic older adults. They're meant to help families better understand what they may not be seeing and to support more informed conversations. If your organization is looking for ways to support Hispanic families navigating through Alzheimer's disease or other forms of memory loss, I'm here to partner with you. This is my passion. I'd be happy to share these insights or discuss how we can work together to serve our community more effectively. And next slide, please. So thank you again to Christine, the entire team, for creating space for this conversation. I also want to give a sincere thank you to everyone who's joining us. Your commitment to our community is what makes this work possible. The families we serve, if there's anything that I've, really believe in, deserve resources, they said it in the research, that respect their dignity and their language. That's what guided this book for me, and it is what will continue to guide my work moving forward. And also, one of the things that I do want to mention is that I hope that families and caregivers will use this book. This book, it is not meant to be read from the beginning to the end. You can go directly to any chapter, and whether it's food and nutrition, movement, socially connection, every chapter begins with my father's journey. And that's what makes the guidance just more informational, but it's also my personal and lived experience. So here's my contact information, and muchas gracias. Thank you again.
Thank you, Mirna, for this
You're
wonderful
welcome.
presentation and also sharing some tips from your book. And I hope
Hmm.
that people can access to it and learn more about what you just discussed. So, as we close the panel session, I want to thank again Mirna for your presentation and for making today's webinar an informed discussion. And now that we have had our final speaker, we will be moving on to the question and answer session. Again, if you have any questions, please feel free to type them in the chat and we will make sure to answer it. So we have some of them, Mirna, and
Hmm.
I will start with this one here that from the audience. So, what are some simple, like everyday actions people can take to protect and improve their brain health? I know you mentioned
Well,
some, but if you want to highlight
yeah,
others.
I think I go into a lot of detail in the book because it's kind of like I said, it's a lot of things. Nutrition is very important. So what I do in the book is I try really hard to, because one of the funny things is you go to the doctor and the doctor says, see, get on a diet, but the diet is really actually for non-Hispanics. So you go to your father, you go to your mother, and you tell them you're going to take away their arroz con habichuela, and they're going to get upset. So one
Mhm.
of the things that is very important is nutrition.
Mhm.
The other thing is movement, like I said. The other thing is social connectivity. You know, sometimes we don't think that getting together as a family at home and creating um, a calendar of how you're going to do that is really something really important. And I have a lot of guides and a lot of tips in the book that allow you to do that. Actually, the book, I have it right here. I don't know if you could see it, but the book has, after each chapter, it has a some question, it has this week's action steps, and it has reflection questions and what's next. So through all of those pillars that I mentioned, I go specifically talking about not only organizations and resources you could use, but also tips on food. I talk about recipes, you know, so it's very detailed. I hope I was able to answer that in a way that was good.
Yes, and also as you mentioned, like eating healthy, and as you mentioned earlier, like going to the doctor and they tell you, okay, you need to eat healthy. Well, one way or another is to go to a nutritionist that
Yes.
can help you like gathering the type of foods that you need based on your culture. So that's another strategy, and also being physically active, like doing Zumba, Tai
Dancing.
Chi,
Dancing is
dancing.
amazing. I was going
Yeah,
to say that dancing is one of the best forms, and it not only helps physically but mentally. It's already proven.
it's true. And getting like enough sleep, staying socially
Right.
connected with family members, friends, colleagues, just to keep um, your brain healthy. And also, we
Mhm.
have some another question here. Let me look for it. And it is how to begin a dementia conversation with other family members and with the person with dementia who may be in denial. How to begin with that conversation?
Is that for me? So I
Yes,
have,
for both.
yes. Okay, for both you and me. The best way to begin the conversation is obviously in the ambiente of your home. And you have to begin the conversation trying to not be defensive or attacking, but bringing in elements of your family. So, like for example, one way you could say, "Oh, Dad, you know what? I think the grandkids are. I would love to play games with you, and or want to walk with you because they could be in denial and they will say no. Like that is a given. So I also have tips in the book about how you can, the resources you could use to actually address those problems. Because I think the most important thing is coming together as a family, the caregiver, the family, and then addressing, well, how are we going to deal with this? How are we going to talk to dad? Not being defensive, talking his language, saying, oh, yeah, Bobby, you know what? I think you're forgetting a few things. And then, do you want to do this? Do you want to do this? And, bringing that up, because that is something that is really important. And unfortunately, what's going to happen is that it, with my father, it took the middle of the journey for him to realize that he did have something going wrong. At the
Mhm.
beginning, he was just like in denial. So it just takes going through all that journey to get to that space where he accepts it, and then you move
Mhm.
forward.
And it takes time. And also, I can also highlight the importance of talking with your healthcare providers, like your
Right,
physician that you trust. And actually, sometimes our older adults trust more their healthcare providers and some family members. So that can be another strategy, just to include the physician in that conversation about memory loss, dementia, so they can be aware, and at the same time they have some practical guidelines when talking with the patient, with that loved
right.
one with Alzheimer's or dementia.
I do, Christine, want to add something that I added in the book, and it's everyone should have a family health navigator. And that is that one person that consistently it could be, the most bilingual, the most tech proficient, the adult daughter, that person that is going to be like the navigator of everything that's going on, and be like you, Christine, a moderator. She's going to
Mhm.
be that person that is going to be talking to the brothers, going to be working to set up the schedules, working to take to the hospital, and making sure she's not going to do it alone. But having that family navigator is also important.
Yes, family connection. Or
Mhm.
sometimes it can be a social worker that can
Right.
also be in that conversation. So it can be easier for both ends, for the families
Agreed.
and the patient. Thank you, Mirna. So we have another one, another question, and it's the following. What should caregivers do if an older adult refuses help or does not recognize that they're experiencing memory problems? This can be like a family caregiver or paid one.
Do you want to take that one first? And I'm going to look for some
Mhm.
information that I have here
Sure.
in the book for caregivers.
Yeah. So this for us, I think of the caregivers. It can be the paid or paid caregiver, family caregiver. They need to be patient. Sometimes it's not easy, but it's not impossible. And I would suggest also like avoid arguing with that person, and instead focus on specific changes that you have been seeing in that loved one or in that patient, that and also encourage them to talk with their healthcare providers. Like I mentioned earlier, if not, a caregiver can talk with the family members to mention what he's or she is seeing, what's different, what should take into care or an attention. So the family members can be aware that something is wrong with their loved ones. And
So,
also it helps a lot to involve someone from the family that the older adult trust. Go ahead, Amina.
um, yeah, I want to, piggyback off of what you said. I think denial often comes from a place of love and protection. So I suggest, again, sitting around the table, doing it in a familiar place, not a medical intervention. Don't make it about the doctor and the medical. You got to start that conversation about what you're seeing. Oh, Dad, I'm seeing this. Or and show, again, that it's very common for our cultura to do this. Instead of fighting, they don't want, they're in denial, they don't want to work with it. So it's
Mhm.
just kind of bringing it up. And I agree, Christine, help from, like, it's very important to get resources and help, and there's resources for caregivers that you can go online. It's in my book as well. You can go online, you could get it through community, through you, like for example, Christine, through the Alzheimer's. Association. And so basically that's what I would do. It's part of our cultura. So it's very hard to, you know, it's unfortunate, but everybody's, ay, es cosa de Dios. That's our thing, you know. No es cosa de Dios. This is finding that balance and that reality where they will get it.
Exactly. Thank you, Beta. I agree. So just to wrap up, I don't. Let me see if we have other questions. We have a final one, Mirna, and it's just to wrap up. If you could share one key message with families today, what would it be?
One key message. Oh my God. I want to go back to to the the fact that we have to acknowledge brain health. We have to your point, you have to have knowledge. Without knowledge, there is no moving forward. And that was the reason that I wrote No Serás una Carga, because I found that there was no written books for our cultura that were from a personal experience and also a guide. So I want to go back to saying, get very well informed, find all the resources you can, not only online, but in your community, and get as informed as you can, because knowledge is power. And again, that's why I wrote my book. It gives you knowledge and it gives you at least a little peace of mind at the end to feel that you are in control. Because when you're taking care, or when you have a family member, and by the way, I always talk about this elders, but this book is for me too. I was getting, I was having memory loss at my age, and I was like, what is this? You know, so that kind of started the whole process. Like, oh, I should eat better. I should go exercise. I should, you know, go dancing and have a social connection. No me quedo encerrada. So again, it's not only for our elder people, but for us who are going into this space. But I think that most important is just getting the knowledge that you can, and from a Hispanic Latino perspective. Busca la cultura.
Yes, I agree. Thank you, Mirna. And I want to also highlight that talking about brain health early, as you mentioned, Mirna, and we have mentioned across the whole webinar, and also to pay attention to changes in memory and ask for help when you need it. That's
Right.
very important. And families and caregivers don't have to do this alone. You're not alone. You have help and resources out there. So thank you, Mirna, once again. And as we finish the question and answer session, we would like to thank all of our attendees and experts for joining today's virtual event. So before closing this event, we invite you to join a growing movement of individuals dedicated to improving the lives of older adults, their families, and caregivers through our individual membership program. For just $25 a year, members gain access to exclusive resources, educational workshops, advocacy tools, and bilingual information on health and aging, all while directly supporting NACOA's mission. So, to learn more about becoming a member, today you can scan the QR code that it's on your screen. So, today's webinar recording will be available on our NACOA's YouTube channel. We encourage you all to follow us in our NACOA social media as X, Facebook, and Instagram by using the following handle at NHCOA for more information and news of upcoming events. So thank you once again, and until the next one. Bye bye.